Most breastfeeding mums will find at some point that they want to give their baby a bottle, and the easiest way to help our babies to feed really well on a bottle and also to transition easily from bottle to breast is with paced bottle feeding. It's super simple to make bottle feeding as close as we can to what your baby's doing at the breast. First thing we want to think about is we really want to avoid having baby lying on their back with the bottle tipped down towards their mouth. What this means for our babies is that when the bottle's tipped up, the milk is dripping out by itself from the teat. So all our babies are doing is just passively swallowing. We want them to be actively feeding on the bottle like they have to on a breast. So the first thing we can do is think about sitting our babies in pretty much an upright position, just leaning slightly back. The next thing we want them to do is try and latch onto the bottle like they do with the breast. So start by taking your bottle and just stroke gently down from baby's top to bottom lip. Wait for them to open their mouth, maybe try and poke their tongue out, and once they do that, then allow the bottle to go into their mouth. The next thing that you want to make sure that you do is get them a nice wide latch on the bottle. So if you see on your bottle where the teat flanges out to the side here, we want your baby's lips to go right around this wide part of the teat. Don't allow them to just take that skinny portion into their mouth. Once they've got that nice wide latch, the next thing you want to be mindful of is keep that bottle horizontal. We don't want to tip it up and just allow all that milk to flow in. We want our baby to actively feed. When you look down at your teat, what you should see is that about half of the teat, so about halfway up, is filled with milk. You don't have to fill the whole teat. As long as it's about halfway and this little hole is covered with milk, they won't be taking in air. But what that's going to allow it to do, keeping it horizontal, is it will mean that your baby has to actively suck to get the milk out rather than gravity just tipping it into their mouth. The last thing you want to do when you're paced bottle feeding is take regular breaks. Take the bottle away from your baby, maybe sit them up, give them a chance to bring out some wind, and then lay them back in your arms and just observe for those feeding cues. Don't feel like they need to finish the whole bottle. Particularly for breastfed babies, their feeds will vary a lot. Some will be much bigger than others. So give your baby a break and then have a look and see, do they seem content and happy? Have they fallen asleep? Or are they still mouthing, poking their tongue out, seeming unsettled? And then you can start the process again by stroking down their lips, allowing them to latch onto the bottle, keeping it horizontal and letting them have some more.